नमस्कार।
नमस्कार। योगेन चित्तस्य पदेन वाचां मलं शरीरस्य च वैद्यकेन योपाकरोत्तम परवरं मुनीनां पतंजलि प्राञ्जलिरानतोस्मि। Namaskar, Dr. Shekhar, all speakers and listeners. I am Dr. Buddhi Paudel from Nepal. Guru, यो PowerPoint खोइ त PowerPoint आएन नि यसलाई फेरि रिकर्ड गर्ने त
हैन ठीक छ
यसलाई फेरि सुरुबाटै गरौँ PowerPoint चाहिँ त अगाडि चाहियो त्यो बोल्ने नि त्यही आधारमा हो नि अब यो सुरुबाट रिकर्डिङ सुरु गरौँ न पहिला क्यान्सल गर्दिन
हैन यसमै कन्टिन्यू गर्दा के गर्नु
एडिट गर्न मिल्छ हस् थ्यांक यू यो यहाँबाट तल तल गयो हुन्छ हैन यहाँ यसरी हुन्छ हिजो गरेको थिएँ मैले छोडिदिनु त अझ
यो स्लाइड पुरै राख
यसरी जान्छ ल ठिक हस् ल सुरु गरौँ हैन नमस्कार योगेन चित्तस्य पदेन वाचां मलं शरीरस्य च वैद्यकेन योपाकरोत्तम परवरं मुनीनां पतंजलि प्राञ्जलिरानतोस्मि. Namaste, Dr. Shekhar, all speakers and listeners. Thank you, Dr. Shekhar sir, for providing this great opportunity in your Ayurveda and Allergy webinar. I am Dr. Buddhi Prasad Paudel, MD Ayurveda Kaya Chikitsa, Senior Consultant Ayurveda Specialist, Officer 10th level, Government of Nepal. My presentation will be introduction on allergy, epidemiology, common types, pathophysiology, clinical features, Ayurveda correlation, role of Ayurveda lifestyles in allergy, and success history in Ayurveda. I am starting my session with introduction. Allergy is a type of inflammation. Inflammation is response of an irritant. Inflammation is response of the body to an irritant, and allergy is a state of exaggerated immune response to an antigen. Allergy is a disease, civilization disease of modern society. Epidemiology. The prevalence of allergies, asthma, and autoimmune diseases has become an increasing problem in the last few decades. Now, pathophysiology. Allergic inflammation is due to a complex interplay between several inflammatory cells, including mast cells, basophils, lymphocytes, dendritic cells, eosinophils, and sometimes neutrophils. These cells produce multiple inflammatory mediators, including lipids, purines, cytokinins, chemokinins, and reactive oxygen species. Allergic inflammation affects target cells such as epithelial cells, fibroblasts, vascular cells, and airway smooth muscle cells, which become an important source of inflammatory mediators. Sensory nerves are sensitized and activated during allergic inflammation and produce symptoms. Allergic inflammatory responses are orchestrated by several transcription factors, particularly NF-κB, GATA3. Inflammatory genes are also regulated by epigenetic mechanisms, including DNA methylation and histone modification. There are several endogenous anti-inflammatory mechanisms, including anti-inflammatory lipids and cytokinins, which may be defective in allergic diseases, thus amplifying and perpetuating the inflammation. A better understanding of pathophysiology of all inflammation has identified new therapeutic targets. Developing effective novel therapies has been challenging. corticosteroids are highly effective with broad-spectrum anti-inflammatory effect, including epigenetic modulation of inflammatory responses and suppression of GATA3. Modern medical science using these corticosteroids to treat these allergic type of disorder, autoimmune disorders, and other disorders is Ramban medicine. But the corticosteroids are quite hazardous also. The side effects of corticosteroids are mild suppression of hypothalamic pituitary axis to severe life-threatening infection, ecchymosis, Cushing-White features, redistribution of body fat with truncal obesity, buffalo hump, and moon face, parchment-like skin, leg edema, and sleep disturbances, weight gain and epistaxis, glaucoma, depression, hypertension, diabetes mellitus, glucocorticoid induced osteoporosis, bone loss leading to fracture, steroid induced myopathy, critical illness myopathy, severe necrotizing myopathy, osteonecrosis, infections, and many GI problems like gastritis, gastric ulcer formation, and GI bleeding, and pancreatitis, visceral perforation, and hepatic steatosis, that is fatty liver. Now I am going to discuss on common types of allergic reactions. Types depend upon rapidity and duration of immune responses. That is immediate type and delayed type. Immediate type, that hypersensitivity reaction occurs within seconds to minutes, mediated largely by humoral antibodies. Immediate type of hypersensitivity is further divided into type 1, type 2, and type 3. Delayed type reaction is slower in onset and develops within 12 to 48 hours, and effect is prolonged, mediated by cellular response. Type 4 is delayed hypersensitivity reaction. Mechanisms of immunological injuries. Now I am going to talk on this topic. Type 1, that is also known as anaphylactic or atopic reaction, a stage of rapidly developing immune response to an antigen to which the individual is previously sensitized. The response is mediated by humoral antibodies of IgE type or reagin antibodies. IgE antibodies sensitize basophils of peripheral blood or mast cells of tissues, leading to release of pharmacologically active substance called anaphylactic mediators. Anaphylactic mediators are histamine, serotonin, vasoactive intestinal peptide VID, chemotactic receptor anaphylaxis for neutrophil and eosinophil, leukotrienes, B4 and D4, prostaglandins, thromboxane A2, prostaglandin D2 and E2, and platelet activating factors. Effects of anaphylactic mediators are increase. The anaphylactic mediators increase vascular permeability. They cause early vasoconstriction followed by extensive vasodilatation. There is anaphylactic shock, increased gastric secretion, increased nasal and lacrimal secretion. Clinical example of anaphylaxis may be of two types, that is systemic and local. Examples of systemic anaphylaxis are administration of penicillin, administration of antitetanus serum, administration of anti-snake venom, sting by wasp and bee. Examples of local anaphylaxis are hay fever, bronchial asthma, food allergy, cutaneous anaphylaxis causing urticaria, wheal, and flare, and angioedema characterized by laryngeal edema, edema of eyelids, lips, tongue, and trunk. Local anaphylaxis is common, affecting about 10% population. About 50% of these conditions are familiar with genetic predisposition and therefore also called atopic reactions. Uh, Type 2 reaction is cytotoxic reaction. Cytotoxic reactions are defined as those reactions which cause injury to the cell by combining humoral antibodies, surface antigens. More commonly, three types of mechanisms are involved in cytotoxic reactions. Cytotoxic antibodies to blood cell, that is first one, and autoimmune hemolytic anemia is under this heading, and transfusion reactions are under this heading, and hemolytic disease of newborn like erythroblastosis fetalis, in which red cells are destroyed by maternal iso antibodies crushing the placenta. And fourth one is idiopathic thrombocytopenic purpura, destruction of platelet by antibodies. And next one is leukopenia with agranulocytosis. And other one is drug-induced psychotoxic antibodies formed in response to administration of certain drugs like penicillin, methyl-dopa, rifampicin, etc. And cytotoxic antibodies to tissue components, second one. The examples are Graves' disease, Myasthenia gravis, male sterility, in which anti-sperm antibody is formed, which reacts with spermatozoa and causes impaired motility as well as cellular injury. More recently, Graves' disease has been categorized separately under type 5 hypersensitivity reaction, stimulatory type. TSH receptor on thyroid cell membranes react with long-acting thyroid stimulating antibody, which in turn bring about chemical overactivity, stimulatory type of thyroid gland, that is hyperthyroidism. Third one is antibody-dependent cell-mediated cytotoxicity, that is ADCC. Cytotoxicity by this mechanism is mediated by leukocytes like monocytes, neutrophils, eosinophil, and NK cells. The antibodies involved are mostly IgG class. The cellular injury occur by lysis of antibody coated target cells through FC receptors in leukocytes. Examples of target cells killed by this mechanism are tumor cells, parasites, etc. Type 3 is immune complex reaction. Type 3 reaction results from formation of immune complexes by direct antigen antibody combination as a result of which the complement system gets activated, causing cell injury. Two types of antigens can cause immune complex mediated tissue injury. That is, one is exogenous and another is endogenous. And the endogenous is more dangerous. In the point of Ayurveda, the armor produced in the body is endogenous antigen, and the autoimmune diseases of modern society is because of this endogenous antigen. I'll talk about autoimmunity, how it develops later on. Depending upon distribution of local distribution and location of antigens, type third reaction are of two types, local and systemic. And there are many autoimmune type of diseases. because of this inflammatory response. Here are many examples. And type 4 is cell-mediated reaction. This type of hypersensitivity is mediated by specifically sensitized T lymphocytes produced in the cell membrane. Cell-mediated immune response. Cell-mediated reactions are of two main types. That is classical delayed hypersensitivity, like tuberculin reaction, and another is delayed hypersensitivity response. That is tuberculosis, tuberculoid leprosy, typhoid fever, and contact dermatitis are the examples of this type of hypersensitivity. And T-cell mediated cytotoxicity is another reaction, that is CD8 plus subpopulation of T lymphocytes are involved in this response. And autoimmune disease. Autoimmunity is common in modern medical society. Autoimmunity is a state in which the body's immune system fails to distinguish between self and non-self and reacts by formation of autoantibodies against one's own tissue antigens. This is known as autoimmunity. Nowadays, it is a problem of medical fraternity. Autoimmune disease are challenging. There is another important hypothesis in case of hypersensitivity or allergic reactions. There is hygiene hypothesis. What hygiene hypothesis says is, if a person is previously sensitized by different mechanisms, then the response of the hypersensitization is low. Like in old time, people usually used to get infestation from worms and skin infections like scabies, impetigo, boils, abscess, etc., and exposure to natural waste and pollens, like playing in open ground and farms. It means people who are close to nature, close to air, close to water, close to soil, are less prone to hypersensitization, and the other infections like pediculosis, etc., are also responsible to reduce the chances of hypersensitization or hypersensitivity response of the body. This is described by hygiene hypothesis. And the most common allergies globally are allergic rhinitis, drug allergy, food allergy, general allergy, insect allergy, sinusitis, skin allergy. Now the clinical features. As we all know, the symptoms of allergy are itchy, watery eyes, itchy nose, sneezing, running nose, rashes, hives, stomach cramps, vomiting. And signs of allergy are running nose or sneezing, pain or tenderness around cheeks, eyes or forehead. As already mentioned, the recurrent allergic rhinitis may cause sinusitis that causes infection of sinuses, and there is chances of sinusitis that causes headache. Coughing, wheezing, and breathlessness are also the signs of allergy. Itchy skin or rash, and there is a test, that is dermatography, red lines while pricking the skin. That is also the sign of allergy. And diarrhea, feeling of being sick, swollen lips, eyes, mouth, and throat are other signs of allergy. And there is another severe type of allergy that is known as anaphylaxis. It is acute severe allergy. Allergic reaction can range from mild to severe. In some cases, allergies can trigger a life-threatening reaction known as anaphylaxis. In anaphylaxis, there is airway, breathing, and circulatory problems and associated with mucosal and skin changes. Now I am going to talk about Ayurveda part. The allergy and autoimmune disease is increasing in modern society and in that highly civilized society. So it is also known as disease of civilization. And it is not a successful case for allopathic science. So Ayurveda can do more on allergies and autoimmune diseases. So I am going to discuss some topics that are mentioned in Ayurveda science. There is mention of Gara Abhisha and Dushi Bhusha in Ayurveda. That is also the mechanism how allergy develops in the body. And another thing is the modern people living in cities and in that urban areas usually um, take that fast food and junk food. The fast foods and junk foods um, um, are preserved by some substances, or they are um, modern food technology provides as a within permitted limit discipline. Uh, those substances are coloring agent, flavoring agent, additives, and preservatives. When a person intakes that fast food and junk food for a long time, these agents deposit in cell and they disturb the physiology of cell, and there is chances of hypersensitivity and autoimmune disease. And this is the O1. 5 times. This is my yukti. My this 30-year clinical practice. The disease scenario is disease paradigm is shifted from infectious to that non-communicable disease. So in my observation, we are disturbing these 5 types of oven, and the people are suffering from the autoimmune diseases. That is oven of nature, oven of kitchen, oven of abdomen, oven of cell, and oven of mind. There is logic after every oven how we are disturbing these ovens. Because of that, people are suffering from allergies and autoimmune diseases. Another thing mentioned in Ayurveda is Viruddhahara. Viruddhahara is responsible to make a person hypersensitive to any substance. The buffet culture, people they are using that food from buffet, and the buffet was developed for entertaining many people in one venue, and the objective of that was the people will select their own food, but in country like Nepal, India, what is happening, they are taking all the things mixing together, and that is disturbing our ovens, what I had already mentioned, and people are suffering from autoimmune and allergic diseases. And another living culture is also responsible for allergic and autoimmune diseases, that is refrigerator culture. And Bhat Bateni culture, there is a Bhat Bateni supermarket in Nepal, and people are purchasing goods from that place, and they are taking packet packaging in bottle and packets. That type of food are taking. That mart culture is not good for health. And air condition culture, when we are enjoying the air condition, then we are not close to the nature and to the season. And another one is washing machine culture. The WHO says physical inactivity is one of the cause of non-communicable disease in modern era. But the women and men are not using their physical activity in cleaning their clothes. They are using that activity is replaced by washing machine. There is lack of physical activity and chances of those diseases. Another is perfume culture. They are unnatural perfumes are they are using. They are not natural and they are harmful to health. And makeup and beauty parlor culture is also responsible for that mm, modern diseases. And culture of recreation with alcohol and recreational pharmaceutical agents, pharmacological agents. People are using alcohol for happiness, sorrow, and success, failure. In all situations, they are celebrating with alcohol. That is not good for health. And vehicle culture, people in our country like Nepal, they are waiting for 1 hour and even for the 15 minutes walk, and they are not walking. The walking culture and the trekking culture is replaced by vehicle culture. So people are lacking their physical activity and suffering from those diseases. And we are not loving the nature, and their livestock feed additives also harm our body. Mm, and so-called sunflower oil adulterated with palm seed oil is also responsible for creating those diseases. There are many researches on that. WHO says there are 5 non-communicable diseases, and for those diseases, there are 5 risk factors. That is unhealthy diet, tobacco, harmful use of alcohol, physical inactivity, and air pollutions. Here is a figure. This is my yukti. I am comparing that running water and stagnant water with the people who are lazy and who are doing physical activity. If we do physical activity regularly, then our body is like running water, river, otherwise like stagnant water pond. And these top 5 catastrophic illness are mentioned by that World Economic Forum. The expenses of those diseases is very high. And there is uh, Ayurveda lifestyles. Uh, these are very good for uh, healthy living and prevention of allergy and autoimmune diseases. There are 3 pillars of life according to Ayurveda, that is healthy food, ahar, sound sleep, nidra, and sexual discipline, that is brahmacharya. And there is a special rule for food, that is ahar vidhi visheshayatan in Ayurveda. There are 8 topics. Uh, these topics are very worthy for healthy eating. And there are good eating habits. There are 8 points on this. This is long topic. And these the Ushnahara mentioned in Ayurveda is replaced by refrigerator culture. That is harmful. I already mentioned that. And we have a biological clock in our body, like 6 seasons in our country. There is 6 seasons in 24 hours in our body, and that is responsible for maintaining good health. We are not aware about this biological clock. And the Sattvic Ahara is good for allergic and autoimmune diseases. We are not following. People are following Rajasi and Tamasi Ahara. There is found problem in this. This is about ghee. I am talking about that oven, 5 ovens. I already told, and I am talking about that mm, we are taking there is ghee phobia, or that fat phobia in the modern medical fraternity. That is not good. And in my experience, this is ghee, traditionally prepared Nepali ghee. There are certain conditions to prepare. This is best anti-allergic agent, and it has many more benefits. We can talk long that session on ghee, and I request Dr. Shekhar, if you can, we can make a project in Nepal to produce this type of ghee, because there are many livestock making natural places in Nepal, and we can produce ghee according to Ayurveda principle there, and that could be helpful in old population. That ghee is good in allergic and autoimmune diseases in my practice. And the another one is that mustard oil we are using for a long time. This oil is good for our health, but we are replacing by different like sunflower oils, palm seed oils, all other oils, adulterated oils that is harmful to our health. And this is about exercise. The term in this computer, the font is digital. The people usually do not know about exercise. The condition, Charak Samhita says, if you are in proper exercise condition, then that should be sweating, the rate, heart rate should be increased, the respiratory rate should be increased. You should feel relaxed after that exercise. These are the rules of exercise. And there are Ritu Shodhana in Ayurveda for prevention of allergic disorder in 3 seasons. And there are Ashtanga Yoga in our Eastern medical science. Yoga, the yogic practices and yogic sadhana is good for allergic and autoimmune diseases. And there are Ayurveda mentions about natural urges, that is Dharaniya Vega, Adharaniya Vega, all the things. These are good for healthy life. And here is take home message. There is one problem. Sorry for that. In my practice, what I tell people is we should awake in the morning in Brahma Muhurta, and there is a sadhana, Brahma Muhurta sadhana for 1.5 hours. We can do yogic practices that time. And we have to take evening meal before sunset, and we have to roam around for half an hour after meal, and we have to make a meeting with family members in the evening before going to bed. And before going to bed, we have to study Gita and other positive books mentioned in our Shastras. And success history in Ayurveda, I am treating many autoimmune diseases and allergies with Ayurveda lifestyles and Ayurveda medicines. That is quite successful. And the referred case from dermatologist, we are getting great success. We have time constraints, so I am not discussing this in this session. I would like to request Dr. Shekhar to organize such type of webinars to disseminate our the success history in near future. And I am concluding my presentation with this last slide. Thank you all. Namaskar. Lagru. यो फन्ट बिग्रियो नि गुरु बिचमा फन्ट रहन्छ हजुर कहाँ गडबड भइगयो नि हेरियो नि